Well, hello everyone. I'm Assemblyman Richard Gottfried and welcome to Represent NYC. In the New York State Assembly, I represent the neighborhoods of Chelsea, Hell's Kitchen, a lot of Midtown, a little of the Upper West Side. And the main thing that brings me here to today's program is that in the Assembly, I chair the Assembly Health Committee. So we've been, as you might imagine, kind of busy dealing with the virus. What we're going to be talking about today is specifically something called contact tracing, which is the process with a contagious disease where health authorities, if they find that you have syphilis, let's say, they want to know who you've been having sex with, and then they go to those people and say, you know, you've had sex with somebody who has syphilis, maybe you should get tested, et cetera, et cetera. It's a process that has, it's generations old. It depends heavily on confidentiality. People don't want to give out information about who they've been seeing, what have you, and just have that be public. And so for contact tracing to work, people have to have real confidence in the privacy of the information. And nowadays, there's also a lot of concern that people don't want the information about their whereabouts going to law enforcement, going to, for many people, they don't want it going to immigration authorities. And since an awful lot of the COVID-19 caseload in New York is people of color, many are immigrants, this is a big issue. And so I drafted legislation which the Assembly and Senate passed about a week ago, and it's now before Governor Cuomo for action, that would provide for strong confidentiality protections for contact tracing information, at least relating to COVID-19. Our guests today are three people who were very actively involved in both developing the idea for this legislation and working with me and others to draft it. So I'm very happy to have them here with us. In no particular order, they are Allie Bohm, who is Policy Counsel for the New York Civil Liberties Union, who works with the NYCLU on particularly on privacy and technology issues. Second is Annette Gaudino, who works on state and local policy for the Treatment Action Group, which is an advocacy group that focuses heavily on HIV and tuberculosis. And finally, Alice Fontier, who is Managing Director of the Neighborhood Defender Service of Harlem, a legal services organization that works on criminal defense, civil issues, family law issues, et cetera. They are three of the main members of something called the COVID-19 Working Group. And they and a couple of other people from that group worked with us on this legislation. So let's turn to them. And my first question is, what is contact tracing? Where is it usually used? And how does it come into play with COVID-19?
Thank you so much, Assemblymember Gottfried. This is Annette Gaudino. I can take that. Just building on what you already laid out in terms of the basics of contact tracing. Contact tracing has a couple of aspects. I mean, one aspect of it, which is really important, is the provision of services. Whether you're talking about a sexually transmitted infection, an STI like HIV, or you're talking about tuberculosis, or you're talking about COVID-19, New York City and any public health authority has an interest in reaching out to people who've tested positive and trying to find out what resources and services they need so that they can get treatment for their infection, prevent ongoing transmission, And, especially in the case of COVID, what they're going to need to support themselves to do social distancing. The other aspect on it, which you touched upon, is sort of helping people tell other people who they may have exposed to infection. And in the case of COVID, because it's respiratory and it's, apparently airborne, although, the terms that are used can kind of fluctuate. It's also about places. Where did you go? Did you, partake of some outdoor dining in a location? No individual would be able to know and have the information to reach out to all the employees of a business or a restaurant that they had visited in order to inform them that they may have been exposed and they should get tested. And that's what a contact tracing program would do. And then it would reach out to those people, encourage them to get tested, provide them with the support they needed. And then if in the unfortunate case that they were positive for COVID-19, provide them with services and so on and so on. So it sort of has that positive impact of proactively reaching out to people and trying to squash outbreaks, make sure they don't happen, but can also be a little bit retrospective, for example, to find out, hey, there may be a cluster that's happening in this place or among in this community. What can we do to put some more resources in there and try to prevent additional infections?
As far as I know, contact tracing is not some newly invented thing. Is that right? I think it goes back generations in public health.
Absolutely. I mean, it's pretty much as soon as we kind of figured out germ theory and really started understanding that infections can be passed from person to person and started standing up public health departments, especially with urbanization and at the beginning of New York becoming like, a mega city. There were people who were out there trying to support people and figure out what was happening with an infectious disease and doing that kind of tracing work. But I think it can be presented sometimes in the press as, contact tracers are detectives and they're trying to find information and do that kind of investigation. And sort of it has a little bit of that air of, that can make it seem like it's something that the justice system would do or that law enforcement would be involved in, when really it's much more of a social work function.
Yeah, and the bill that we wrote together says that contact tracing information can only be, without the patient's consent, can only be used for contact tracing. And there is a special provision for consent to use that information for providing support services for the person or a member of their household. As you were saying, helping them get food, get shelter, get a place to stay, etc. One of the key things in the bill is it says that law enforcement and immigration authorities may not, in New York, work as contact tracers, and the information may not be provided to anyone in law enforcement or immigration authorities. Why is that important? Why would law enforcement or immigration be interested in this information?
Right, I think that's a good question. I think that's a good way to frame it and to think about it. I would sort of ask the question, do we want firefighters to be contact tracers? How about teachers? What about nurses? I think those folks have really important full-time jobs to do, and that's also the case for law enforcement officers. And contact tracing is a serious full-time endeavor that requires a lot of attention, focus, and training, and really should, be a workforce that comes from the communities that they're serving. So kind of asking people who already have a professional role in society and in the community to then take on this other really complicated role doesn't make sense on that level. But it's also, if you look back at the history of infectious disease and law enforcement, thinking particularly around HIV, it's not a great history. The beginning of the HIV epidemic in the 80s saw, unfortunately, a wave of criminalization laws passed through the country. Most of those laws are still on the books, even if they're very rarely enforced. They include provisions against, criminalizing non-disclosure of your status to partners, and things like, added charges for spitting on a law enforcement officer, even though we know that that's not a way that HIV can be transmitted. So unfortunately, in the heat of a deadly pandemic, sometimes science gets pushed to the side and we act from fear. And so fear is not a good place to be in when you're trying to do public health. And you need trust is very, very central to all of this. So rather than trying to fix all those issues with regards to communities and law enforcement, and you can't wipe out this history, it's best to just really make a strong dividing line between the functions, I would say.
Allie or Alice, do you want to weigh in on this? I mean, the prohibition of involvement by law enforcement or immigration is not just a labor law issue about whether they should have a second job, because somebody who sells shoes could moonlight as a contact tracer, I suppose. It's more than that with law enforcement and immigration.
So yeah, I would really love to weigh in on that, because I think you need to understand, people need to understand that there are a couple of issues at work here. One is, in many communities, the inherent distrust of police and immigration officers. So if a police officer knocks on your door and says, "Where have you been? Who have you been in contact with?" there's very little likelihood that people will want to answer those questions or will agree to answer those questions. Mm-hmm. And that is particularly, that distrust, as we have seen in the events of the last couple of months, is particularly deeply held in communities of color. And those same communities have been already disparately impacted by the coronavirus crisis. There's been higher rates of infection, more deaths, the economic impacts will continue to be felt. We all agree that contact tracing is a necessary and very important tool in the battle against coronavirus. And because of, as you have already mentioned, the way in which the coronavirus is spread, the information that needs to be gathered in order to really do contact tracing needs to also be very widespread. You need to know where people have been, who also was in those places, not necessarily that I personally talked to you or I had physical contact with you, but who else was in the same place at the same time. And then from there, who all of those people talked to. So it is a lot of information, and it is about people's location and about their associations. And that information, where you go and who you talk to and associate with, is very much of interest to law enforcement. The NYPD has a massive electronic surveillance system that gathers data from a lot of points, whether it is license plate readers, arrest records, turns out also sealed arrest records, 911 calls. And if there is the ability to add, if contact tracing does become what it needs to, which is widespread and prevalently used, that is a massive amount of information and data about people's private associations and where they are and who they talk to that could easily be tapped into by law enforcement if this bill is not signed. And that is, the fear is, one, that people won't participate if they are not sure that their information is not safe. And two, that the police and or ICE will use that information against people. We saw immediately how social distancing rules were used against people. In the very first weekend, those rules were weaponized against communities of color. 38 out of the first 40 people arrested were Black people. And so the fear that this will also be weaponized, I think, is very real. And there's no good reason that law enforcement or ICE should have this information.
Allie, I know you taught me certainly a lot about technology as we were working on this bill. The bill talks about I mean, I understand the issue of people hacking into a database or being given access to a database and learning a whole lot about somebody, but we were talking about information being de-identified, so that it's a bunch of data that doesn't have people's name on it. And the bill goes on at more length than I've seen before, about proper technological safeguards and the like. And I mean, I gather part of the issue is that if you find out that somebody in this database lives on the west side of Manhattan, last Monday bought size 8.5 black shoes at Macy's, Facebook or Google could probably figure out that that was me. In case anyone's interested, I did not buy shoes last Monday, but recently. Please expand on that a little, and the need for more than just saying, oh, the information when it's stored should be de-identified.
Sure. So, you've sort of described it very well, Assemblymember. If I have enough data points about a person, I can identify who they are, even if I don't have their name or their zip code or their birthday, or even, what color their hair is or what color their eyes are. We each have very unique patterns of movement. So, someone who is going from the location where I live, well, in our past lives when we commuted to work, someone who had my commute to work, who got on, at the subway station that I get on and got off in Lower Manhattan near my office, that's probably me. I don't actually have that many colleagues who live near me. Contact tracing, as Alice and Annette described, requires individuals to share the intimate details of their lives. So it's location and travels, it's associations, it's also their health status, right? Are they COVID positive? Who are they spending their time with? That's the associations. And there are many, many individuals. So, we certainly think about undocumented immigrants. We think about LGBTQ youth who come from unsafe homes. We think about people who live in apartments with more people on the lease, that are more people in the apartment than they have on the lease. We think about survivors of domestic violence and sexual violence. We think about over-policed communities. All of these folks could be at risk if information isn't held securely and if information is re-identified. And of course, NYPD and I certainly have a history here of taking information and re-identifying it. But even for folks who don't fall into one of those categories, there can be risks if their information is not properly secured or properly de-identified. So, for example, police in Minnesota, in response to the recent Black Lives Matter protests, said that they were going to start, quote unquote, contact tracing protesters. That instantaneously chilled participation, not in the protests, but in the public health response to the coronavirus. We've recently heard of a large credit bureau that is discussing creating a map of COVID hotspots. It's unclear what they want to use that map for. I sort of snarkily said, or do they want to reduce the credit ratings of people in areas that have had large COVID outbreaks? Do they want to increase the credit ratings? But I suspect that if they could pull from contact tracing information for their map, they would do it. It's not hard to imagine snake oil salespeople targeting folks who have tested positive for COVID to try to sell them fake remedies. We've seen that happen in other countries, and they don't need to know the names of people or their email addresses to do it. They can just put in a profile for targeted advertisers and get those people using all de-identified data.
The city of New York is working with a data storage company to store the contact tracing data. Is that something that we ought to be up in arms about, or are there adequate safeguards built into their contracts that we know of? And does this bill add protections to that?
The answer to your first question is it depends. We don't actually know what's in their contracts. And we don't know on a technological basis whether a private company or H&H or DOHMH or the Department of Health is going to have more secure computer systems. What we do know is what we're requiring in the bill, which is a certain level of security protections. And we're requiring the city and the state to regulate about what those standards would be and make sure they're protected. We're also requiring regulation to make sure that there are both technological and policy safeguards for de-identified information. So technologically you have to de-identify it, but because we know it's trivial to re-identify de-identified information, you also have to put in place policy safeguards not to re-identify, not to share that information, which you shouldn't be doing under the bill anyways, in ways that would allow it to be re-identified. And the other piece in the bill is that we're requiring when a private entity has it sort of in its private entity hands, as distinguished from in a locked box that only the government can access, that they de-identify that really, really quickly, or they delete it really quickly. And when I say really quickly, I mean within 30 days. They get a one-time 15-day extension if contact tracing is ongoing, but only with the consent of the person to whom the information pertains. So we're really trying to limit contact tracing information in private hands, and we're trying to make sure that wherever it is, it has good security. I should also, as I'm sort of talking through this, I know there are probably some public health researchers out there who are saying, but what about the research? We actually thought of that also. And so the bill has protections to allow public health research. It's super important, right? We want to track disparities. We want to track the course of a virus. However, it's with de-identified information, with those safeguards that I talked about. And it's also with the oversight from Department of Health if you're in the state, and DOHMH if you're in the city, in order to make sure that we're talking about real research, not, something abusive. I sort of snarkily say we don't want another Cambridge Analytica with our contact tracing information. We want to make sure the research is actually for public health purposes.
A long time ago, 32 years ago to be precise, we drafted and enacted legislation to protect HIV information, particularly information about testing and testing results and treatment, et cetera, because we were very concerned back then that given a lot of the stigma attached to HIV and to populations that where it was concentrated, that in order to encourage people to come forward and be tested and to get into treatment, we had to guarantee an extraordinarily high level of confidentiality. And I remember when we were drafting that, I started out saying, well, gee, aren't there laws about protecting all confidentiality of all this information? And so I went to look for those laws, and guess what? They weren't there. And we realized we had to largely build from scratch confidentiality legislation, which we did, and it became a kind of a national landmark. But my question is, the reason we did that was largely because of a concern about stigma attached to HIV, people not being willing to come forward and be tested and treated. With COVID-19, is there any of that concern, or is it primarily concern that you don't want the police or immigration or somebody selling snake oil to know who you are? Is there a stigma concern or a discrimination concern?
I think that we want our contact tracing program to succeed. We need it to succeed. And issues of confidentiality and stigma and legitimate fear of law enforcement involvement are inextricable from that success. So while I think it's hard to compare the stigma, we have definitely seen an increase in racist attacks against people perceived to be and communities perceived to be, burdened by COVID. We've seen violence related to mask wearing. So, you can't discount that. But I also just think that these issues, regardless of how you compare how they compare historically, you just can't separate them from the, setting up the program for the success and the needed success.
I think that's absolutely right. And I just want to add in that, the one big difference between now and 32 years ago, and thank you for that, Assemblyman, very necessary, obviously, is that there is also the advent of smartphone apps. And many places are using smartphone apps to do contact tracing. And, if and when that becomes a reality in New York, then very easily every person's location and associations can be tracked through the app. And that has the potential to just truly create an electronic surveillance web that is frightening, quite frankly. Immigration uses your court doc information to go arrest and deport you from when you appear in court. Protect Our Courts has passed. We need to get that signed as well. But, and the police departments do the same thing. And so protecting that level of data is incredibly important.
Quick question, because we're almost out of time. In the discussion about the debate, about the bill, one of my colleagues said, well, gee, shouldn't the contact tracing people tell your employer that you are COVID positive? And I said, I don't think so. Not if we want people to participate in contact tracing. Am I right?
You're absolutely right. If people are afraid that participating in contact tracing or even having a positive COVID test, because you'll get funneled into contact tracing, is going to lead to you losing your job, to potentially being deported, to being criminalized in some way, they're simply not going to participate. They're not going to participate in contact tracing. They might give fake contacts if someone calls, but they also might not even go get tested and get the treatment they need in the first place. And so it is truly critical that we have these protections. And I think the thing that I wanted to say is we modeled these protections on the census, because we know that we want people to participate in the census. We want people to be counted so that we know how much resources to give to each place, how to distribute congressional representation. And so we say, there are no repercussions. You participate, it's not going to law enforcement. It's not going to be used against you in court. It's not going to lead to your deportation. It's the same thing here. We want people to participate in the public health response. We want people to participate in contact tracing. And so this information isn't going to be shared with your employer. It isn't going to be shared with law enforcement. It isn't going to be shared with immigration enforcement. It's not going to be shared with anyone without your consent. And that's why this bill needs to be signed now.
Well, I think we're about set to sign off. Our guests have been Allie Bohm from the New York Civil Liberties Union, Annette Gaudino from the Treatment Action Group, and Alice Fontier from Neighborhood Defenders Service of Harlem, who've been very actively involved in COVID-19 issues and worked very closely with me and my staff in drafting the confidentiality legislation that is now awaiting the governor's signature. I'm Assemblyman Dick Gottfried, and this has been Represent NYC. Thank you for watching.